is our very own Steph, who works on our helpline and support services. So if any of you have ever accessed that, you have had the pleasure of speaking to Steph. And we're also joined by Debbie Thomas, who is a lead gynecology oncology nurse in Northumbria. And she has 20 years experience of women's health and working with mental health and wellbeing as well. And both Steph and Debbie are level 5 trainee counsellors who are at the very end of their training and will soon be fully qualified. So we're in really good hands. And without any further ado, I will hand over to Steph and Debbie.
Thanks everyone, and welcome and thank you for coming. It's nice to see so many of you here today. So what I'm going to do is just initially start with a quick snapshot of what migraine is and its stages, even though I'm sure most of you are aware, of this, but it might be useful for those that aren't aware or family members that may have joined. So what is migraine? So migraine, as we know, is a complex brain disease. It's not just a headache. It's the third most common disease in the world, with estimates suggesting that around 1 in 7 people have migraine, which is approximately about 15% of the global population. And that's greater than the number of people living with diabetes, asthma, and epilepsy combined. There's approximately 10 million people living with migraine in the UK, and it's 3 times more common in women compared to men. And living with migraine, as we know, can severely impact a person's mental health, well-being, relationships, quality of life, and ability to do everyday to-day tasks. There are different stages to a migraine attack, and most of you, may know what these are, but this is just a quick breakdown of the stages and the symptoms for those that don't have some of these stages. First stage is the premonitory stage, which is sometimes described as the warning stage, in which there are certain physical and mental changes that can occur. So these can be things like feeling tired, excessive yawning, food cravings, and also changes to the mood as well. So feeling down or irritable, for example. Some people then may go into what we call an aura stage, but not everybody has this stage. And it does affect around a quarter of the people with migraine. The aura of migraine includes a wide range of symptoms. So that can be changes in sight, so typically your visual disturbances. So some people may see dark spots, flashing lights, for example, blurriness, zigzags. You can also get numbness or pins and needles, usually down one side of the body, but it can impact both sides as well. And there may be weakness, dizziness, and vertigo, and speech issues, and many different memory changes. So feelings of fear and confusion. And very rarely, some people may have full partial paralysis or even faint within this stage. It then moves into what we call the typical headache stage. And this is a throbbing that is normally made worse by movement. It tends to be on one side of the head, so especially at the start of an attack. However, you can get pain on both sides, or it can be all over the head. And it can be followed with things like nausea and vomiting. You might have light sensitivity, for example. You might be sensitive to sound and smells and movement. And once this stage is kind of like the peak of the migraine, and then it starts to resolve and moves into what we call the postdrome stage. And it's typically referred to often as a hangover period, where you can spend, anywhere from a couple of hours up to a few days feeling drained, fatigued, or having that kind of hangover type feeling. And often this stage can mirror the premonitory stage. So, for example, if you lost your appetite at the beginning of the migraine, you might then find that you're particularly hungry in the postdrome stage. And if you were tired initially, you might then have, more energy than usual. And it can be a long process for a person to go through when having a migraine. Often the pain can cause a person to become irritable, moody, they might become unsocial, you might feel really fatigued and confused, but it can also bring up feelings of being anxious and depressed as well. And you may have experienced other symptoms affecting your mental health, well-being, and your quality of life, causing barriers to what it is you feel you are able to do. We done a previous survey as the Migraine Trust just on the impact of migraine. And we asked people to describe in one word, particularly how the migraine makes them feel. And this word cloud kind of shows the impact of that. So the bigger the word, the more often a person said it. And as you can say, right, see in the center there is debilitated. And it is a really debilitating condition. Some people feel broken. Some people feel exhausted or useless, for example, frightened, miserable. There's lots of different emotions and feelings there, which we can see within that word cloud. So mental health and migraine triggers. So there are a number of triggers for migraine, which a lot of you may know, such as foods, for example, environmental factors. However, the ones that can impact our mental health typically are stress, anxiety, depression, and hormonal changes. So the hormones are particularly important as we have to consider the mood altering symptoms that can occur with menstruation, perimenopause, and menopause as well. So what I'm going to do now is I'll pass over to Debbie, who's going to just have a chat through some further bits about hormones and migraine.
Thank you. Welcome, everybody. So hormones and migraines. And migraine is more common in people that menstruate. This is particularly because of the fluctuations in hormones, particular estrogen, and this can be a trigger for migraines. So many people with migraines have their first migraine attack during their teenage years, and it can often predate the time that they're going to start their periods. So they might start with a migraine leading up to the start of their period, and then it can continue on a cycle. Around half of the people that might menstruate have migraine, and they do state that their menstrual cycle directly affects their migraine, and they can find that this happens on a monthly cycle. So many people that menstruate find that the migraine becomes less severe and frequent and may even disappear by around the age of 50. So this relates to the age of menopause. And that's because we also have a change in our hormone levels at that point. Some find that their migraine attacks are linked to their periods during the perimenopause. And once periods have stopped, the hormonal cycle can continue for years afterwards. So this means that some people can continue to get migraine attacks on a monthly basis, even when their periods have stopped. So even when we go through the menopause, we still have a low grade amount of hormone that secretes, but not as much as we would have during our normal cycles. So for most, the migraine attacks settle down 2 to 5 years after we've gone through the menopause. Some people find that the migraine gets worse during the menopause. However, this can vary from person to person, and it's impacted by a huge range of factors. During menstruation, you can experience heightened emotions, so particularly anxiety, depression, stress, mood swings, lack of sleep, irritability, or all of the above. So the perimenopause and menopause can be similar to this. However, menopause can impact your mental health and as well as your physical health. So again, you may experience feelings of anxiety, stress, or even depression. Due to the impact of hormones on migraine, often increasing migraine attacks, and then the hormonal impact of having symptoms of anxiety and depression can impact on a person's mental health and well-being. So again, they're starting to feel the decline due to a change in their hormones without then adding a migraine on top of this. So when you combine them both together, it can have a further impact on that particular person. So migraine and stress. Stress is how we react when we feel under pressure or threatened. And it usually happens when we're in a situation that we feel as though we can't manage, or it's something outside of our control. So this could be situations like your work life, your home life, added responsibilities, or a degree of illness, chronic illness, etc. And it can be a combination of all of these factors from time to time. So stress on some degree is considered normal and healthy. And a small amount of stress can help us to complete tasks and feel more energized. However, for some, if stress continues for a long period of time or becomes quite intense, then it can become a problem which starts to affect our physical and mental health. If a person or you feel particularly stressed or irritable, we can often feel overwhelmed, anxious, depressed, sometimes isolated. We can start and experience a loss of enjoyment in things that we would have once enjoyed. We can become overly worried, and stress can impact mental health, existing mental health problems, and sometimes make them worse in some cases. When we relate this to migraine, stress can be a trigger for migraine, and it's caused by which can cause a migraine, and people often find themselves in a cycle of stress. So things happen, they try and get on with things, it then gets on top of them, and then they feel more stressed, which then leads on to a trigger in the migraine. And what we're looking at today is different ways that we can cope with this. For some people, it does progress to what we call post-traumatic stress disorder, which again can impact on migraine and the quality of life. And this is something which would have a diagnosis in itself. So it's a time when we become particularly triggered by the thought of a migraine and the stress and things that are related to it. And that in itself can increase how we feel in ourselves. If this is the case, what we would advise is that you speak to the GP, or, come and ask for some advice from the charity, or use the NHS website, and ask for referral to counselling. And there's lots of different places that do offer counselling and support for those who find migraine are really having a huge impact on their mental health, more than just the day-to-day stresses. So depression and migraine is also quite common. So depression affects people in different ways and can cause a wide variety of symptoms. The symptoms range from lasting feelings of unhappiness and hopelessness to losing interest in things that you used to enjoy, sometimes becoming quite tearful. This is different to just a relation of stress. So we can often find some of these symptoms with stress come and go, but when we're looking at more depression side of things, these are things which do continue over a longer period of time and don't seem to come and go. So many people with depression have symptoms of anxiety as well, so sometimes a combination of both of these factors. So the physical symptoms can also include feeling tired, having poor sleep, not being able to concentrate, having no appetite, various aches and pains. Again, sometimes, having no appetite, it can also be the opposite and having kind of a binge cycle. Some of the symptoms can range from quite mild to quite severe. So at its mildest form, you may just feel simply quite low, can't be bothered, a bit low in spirit. However, those with the more severe depression, it can make you feel that life is no longer living. And that has a huge impact on the individual. It's important to remember that most people experience feelings of stress or anxiety or low mood. It's quite common during difficult times, and the low mood may improve after a short period of time rather than progressing longer, which can then become a sign of depression. Sometimes there's a trigger for depression, so things like life-changing events such as a bereavement, losing your job, giving birth. All of these things are particular significant life events which can kind of trigger something in us. So long-term illnesses or chronic pain can also lead to depression, and you can find that those with a frequent migraine and symptoms that come with these things are more difficult to manage on a day-to-day basis. So things like working, social activities, managing everyday life can become particularly difficult. Many of the physical symptoms for depression are similar to those experienced during a migraine attack, and this is particularly in the post-stroke stage after an attack. Due to this, it can often be difficult to know if it's the migraine causing us to feel low, or whether or not we have a degree of anxiety or depression. And it's worth just keeping an eye out on how you feel, particularly after a migraine attack, to kind of see if your mood does lift in between, or whether or not this is something that's becoming quite persistent. If it is something that you're worried about, or you kind of notice that this is something that becomes more persistent and becomes a problem for you, affecting your quality of life, we would advise that you have a chat to your GP just to get some further help if you feel depressed. So that leads us on to anxiety. So Anxiety is a feeling of unease. It can be a particular worry or a fear. Again, some kind of feeling of uneasiness. And again, this can present quite mildly or it can become more severe. So it's normal for everyone to have feelings of anxiety at some point of their life. This could be something just like an initial worry about a job interview or meeting somebody for the first time or a particular exam or social event. Or sometimes, you know, if you know something's going to happen, that kind of degree of anxiety into the unknown. So anxiety and mood disorders have been shown to be the most relevant psychiatric comorbidities associated with migraine. And this can sometimes impact on the course of diagnosis and treatment. So studies have reported that mood and anxiety in disorders are 2 and 10 times more common in people with migraine than the general population. And this is due to the lack of ability to properly control worrying and to relax. Obviously, when you know that you can have a migraine, it can increase our feelings of anxiety when you can feel those symptoms starting to build. So we often find ourselves worrying about the next migraine attack, when this is going to occur. Is it going to stop you going out? Is it, you know, what impact is it going to have on your quality of life? How bad is it going to be? And for individuals, this can become all life consuming and just kind of really dominate those thoughts. So I'm just going to pass back over to Steph now, and she'll just continue talking about the impact this has on the quality of life.
Thanks, Debs. So migraine can impact our quality of life. It can often lead to us cancelling plans, calling in sick at work, and even missing time with our families. So we often feel a need to isolate ourselves into a dark, quiet space, and that can be very difficult and have a debilitating effect on how we feel about ourselves. There is an element of feeling guilt, shame, embarrassment, and disappointment with migraine when it impacts our ability to live what most people will call an ordinary life. And you may feel that you've let people down, that you don't spend enough time with your children, or you may not be able to work due to your migraine. And that can feel disappointing. And, you know, you may feel that you're not able to financially support yourselves or others. And there are many, many more examples as to what this could relate to. So I have chronic migraine, and from a personal perspective, I understand all of these feelings and emotions. So I've had my migraine diagnosis since childhood, so probably from when I was about 6. I believe mine started as abdominal. It then went into headache migraine as I reached my teens. But more recently, I spent over 4 years just in daily pain with chronic migraine and also chronic daily headache as well. And I would wake with a migraine, go to sleep with a migraine, and it was constantly, permanently, always there. And I understand how difficult it is because my day-to-day routine at the time consisted of working, going home, feeding my children, and then going to bed. And that's literally all I done. And I would wake up and then I would have another one. So I understand how awful the impact is on quality of life and the emotions and the feelings that come with that. When I had to cancel many meetings and going out social events. I had to miss birthday parties and things because I just wasn't well enough to go. And that period in my life was very, very difficult. And I did have many dark thoughts. And to be honest, I feel that without my children, I don't even know how I would have really got through that time. But for me, I had to persevere. I had a lot of medications, but I finally found something that did work for me. And it has given me some quality of life back. So I think the key message there is that, it can impact our well-being and it can impact how we feel about ourselves. And it's important to remember that self-care is also vital and important as well. And no matter how difficult life is or how isolated you feel, you are not alone. So do reach out to us, speak to your family and your friends for support, because it's a debilitating condition and often it can be very lonely, but hopefully there are some people there that can speak to you, and the Migraine Trust is always available. As part of my counselling qualification, I actually done a small study on the impact of migraine on mental health. And the slide here shows some of the quotes that were taken from the responses that I received. And I feel that these do show the impact of migraine on the quality of life. And as the Migraine Trust, we are actually just releasing a larger survey, which Debbie spoke about at the beginning in the introduction, the link in the chat. So we will be looking at the impact of migraine on mental health more deeply. And the link will also be in an email that will come out to you at the end of this talk. So if you can do that, that would be really useful. But if you have skim through the quotes there on that slide, you might find that you can relate to how some of these people are feeling. And for myself, I particularly like the last quote at the end, which is, there's limited people who understand or care about the impact of migraine. This in itself is isolating and adds to the feeling that migraine isn't a proper disease. And often those of us with migraine, we do feel misunderstood. We feel that people feel it's just a headache. They don't understand what migraine is. And that can sometimes cause us not to speak up about how it impacts us because of the stigma of migraine, the misconceptions and the impact that this has as well. So, I think no matter how you're feeling, although it does seem like we are alone, there are many others that may feel similar to what we do as well. So I think it's important just to do a little bit here about treatments. It's just going to be a quick section because I'm sure most of you are aware of what the treatments are, but there may be something here that you haven't tried, which might help just with some of your migraine and the physical symptoms that you are having. So there are acute treatments, and these are normally your pain relief medications, things like paracetamol, ibuprofen. Commonly, the triptans like sumatriptan will be prescribed. And it's useful also to ask for an antiemetic medication, which is an anti-sickness that can help with the nausea and any vomiting that you may have as well. And it's important really to consider how often you're using acute treatments and pain relief, because there is that risk of medication overuse, headache, which can occur if you do use pain relief for generally more than 15 days in a month. And that's where preventive medications really come into force. So these are taken every day, and they aim on reducing the frequency and severity of the migraines. And they include medications. Some of these you probably have heard of, so amitriptyline, propranolol, candesartan, and topiramate. But they're not pain relief medications, so they don't have that risk of the medication overuse. And if you've tried like 3 of these preventive medications, you can then often be referred on to a neurologist. And within neurology, you may then have the option to try things like Botox, which is approved on the NHS for the treatment of chronic migraine in adults. And you need to have tried 3 preventive medications to qualify for that. And also to have what they call chronic migraine, which is defined in having at least 15 headache days a month, with at least 8 of those featuring migraine symptoms. So most people generally have 2 cycles of Botox to see if it's effective for them. And a good response to Botox is usually a 30 to 50% reduction. So it may not fully get rid of the migraine or headache that you are having, but it can help to reduce it to a more manageable level. There are also the new calcitonin gene-related peptide medications, which are commonly known as the CGRP treatments. And these are medications that work on blocking the calcitonin and the receptors, which then effectively aims to block the migraine. They're generally an injection, which is done every 4 weeks at home with self-injector pen, but they are only available via a neurologist. And more recently now, actually this year, we have had the newer medications released, which are the GPAN medications. These are rimegepant and atogepant. And they're both CGR treatments, but the difference with those is that they're in a tablet and a wafer form. So rimegepant can be used for acute use, so it can replace things like triptan medications if you can't tolerate them. But it can also be used as a preventive medication if you have 14 or less migraine headache days a month. Whereas atogepant is available for chronic migraine, and it's for over 15 migraines a month as well. So these are fairly new, and some areas may take a bit of time to have these medications available on prescription. They're usually prescribed via a neurologist. However, atogepant can sometimes be prescribed by a GP. but that does depend on the area and the local guidance that's enforced. So you can speak to your GP about the atogepant, and if they can't prescribe it, they may be able to just seek guidance from a neurologist without having to actually do a neurology referral. And if a neurologist confirms by email or letter the dosage and that the prescription can be done, then often they can get this prescribed for you. And then there are the non-drug treatment options. And, some people with migraine might find they can't tolerate drug type medications. And this is where things like using heat or cold packs can be really useful for migraine. There are supplements that can be used as well. So you might probably heard of these. So there's magnesium, which is 400 milligrams a day. You've got riboflavin, which is vitamin B2, and that's 400 milligrams a day as well. And there's also coenzyme Q10, and that dosage is 150 milligrams a day. So these dosages are higher than those recommended for general dietary use, but these are the specific doses for migraine which are recommended, but they can take about 6 to 8 weeks to develop the full benefit of using them. And if you are going to start any form of supplement, it is advised to have a chat with your GP just to make sure that it doesn't contradict with any other medications or anything that you may be on. There are also devices as well. These are non-invasive medical devices, and there is one called the Cephally device that can be helpful for migraine. And it uses an adhesive electrode which is positioned on the forehead, and the device connects to this. And then through the electrode, it generates precise micro impulses in order to stimulate the nerve endings of the trigeminal nerve, and regular repetition of using it. So you can use it every day as a preventive, or some people will use it as and when the migraine occurs. But this can also help reduce the number of migraine attacks. And there is also acupuncture, which is a favorable medication as well that some people do like to try. It's a non-drug option. Some people find that it can help. Some people find that it doesn't make too much of a difference for them. So if there's anything there that you haven't tried, it might be worth speaking to your GP or your neurologist about those, as they might just help with the migraine, which can then obviously help to change in your quality of life. And obviously, the management of that. So if we move on now to self-care, bear with me, it skipped a little bit there. Right, so if we move on now to self-care, so the impact of migraine can have on our mental health is really powerful. And sometimes you find that you can't go on, or you can't live like this anymore. And that's okay to say. And self-care means taking care of yourself, that you can be healthy, you can be well, and you can do all the things that you need to do, or want to try and accomplish in a day. And self-care, it helps us cope with the daily stresses and difficult events, and not being able to unwind and slow down can cause us to become anxious and overwhelmed. It can help us to relax if we take care of ourselves and de-stress, which can help prevent migraine from triggering. So self-care practices, they don't necessarily need to be long. They just need to be a few minutes each day. And these can include things like just taking time out to have a cup of tea, away from any disturbances. Some people find meditation or yoga can be helpful. Swimming can also be very therapeutic, or going for a walk, for example. But the key really is to try and relax just for a few minutes and step away from that daily hustle and bustle, and just remember yourself, and just remember your self-care and well-being are important too. And we often forget about ourselves when looking after others as well. But to continue to support others, we need to make sure that we're supporting ourselves. And it might be worth just having a think about what you do each day. And if you don't have any time to yourself, maybe try to implement that into the day-to-day routine, because it can help with, any feelings of anxiety, stress, or depression. And it can just help kind of put that balance in place, and to ground back into the here and now, and to be more settled. So there are coping strategies and skills that can be used to help with stress and anxiety and general well-being. So I'm going to pass back over to Debbie now, who's just going to go through some of those grounding techniques. in a moment. So grounding is really useful because it helps you distance yourself from an emotional experience when you experience those negative emotions. So for example, painful memory, which might be your last migraine attack, it can be your brain's natural instinct to start the involuntary physiological change known as that fight or flight response. And although this response keeps you safe by preparing you to face and escape from or fight the danger, the memories do not present a tangible danger themselves. So you might find yourself in those kind of moments, and then the grounding techniques can help change the body to calm itself down and to return to the present moment, which can then minimize the potential anxiety and stress migraine triggers. So those can just help, as I say, to keep you grounded and just to help improve anxiety and well-being. And Debbie's going to go through some of these techniques now for us, starting with the 5, 4, 3, 2, 1. So I'll pass back over to you, Deb.
So different grounding techniques. So again, they're really, really useful in what we do. And these can be done, you know, as Steph mentioned before, just about having 5 minutes with a cup of tea. And this specific one is called 5, 4, 3, 2, 1. And it just helps us to purposely take in and focus on the details of where we are, using each of our senses, being aware of all of the sensations that we feel. So we start with looking around us and using our eyes to kind of highlight 5 different things that we can see. So again, really kind of looking and focusing on small details such as the pattern of something. You know, if you're in the house, you know, maybe the way the light reflects on a particular surface coming through the window, or even just noticing like the material of something, you know, kind of the pattern on it, what things look like. Once you've done that and you've had a good look around and you've like noticed these 5 things, we then move on to kind of 4 things that we can feel. So again, these are things that like give us the sensation. So things that we can feel on our body. So this might be clothing on our body. It might be feeling the heat of the sun on our skin. It could be the feeling of the chair that you're sitting on. So kind of to really take a note of what it feels like for your body to be sat up against something. It also might be looking at something in its weight. So, you know, you might have an object that you can pick up, that you can hold, you can feel. Does it feel cold? Does it feel hot? Is it smooth? Is it prickly? All of those sorts of things. And you're really just using these to kind of ground yourself into what's going on around you. Then we're moving on to 3 things that we can hear. So again, paying special attention to the sounds of your mind. You know, so you can close your eyes, you can think about it. So this might be things like a ticking clock. It might be the birds singing. It might be the trees blowing. It might be the rain against the window. It could be some traffic. It could be even voices in another room. It's just kind of getting you to kind of reorientate yourself into where you're at. Then we're going to look at 2 things that we can smell. So noticing different smells in the air around you. So becoming specifically tuned into, you know, definitely what's in the air around us. So it could be a candle. It could be freshly cut grass. It could be flowers. It could be an air freshener. It could be a perfume. It could be somebody cooking if you're in the house, all of these sorts of things. And then finally, we're going to go to 1 thing that we can taste. So that might be because you've got a sweet in your pocket and you're just going to pop that in and you've got that real taste of something that you enjoy. Or this could just be, you know, like, what does it feel like in your mouth? What can you taste? What's the last thing that you had? You know, and it's focusing in attention on your flavors, you know, really kind of honing in on your own kind of intuition in your own body. So again, this is really useful to do, just taking 5 minutes with a cup of tea, just to switch off. Doesn't have to take very long at all. So then we go on to kind of different categories of mental exercises. So again, these are just different ideas that we can use to reground ourselves, refocus, and take our attention away from some of the uncomfortable feelings that we might anticipate some anxiety. So these 3 categories that we look at. So again, you can spend a few minutes on each category. So again, things like counting backwards from 100. So you might want to just sit and kind of take in the numbers, counting back. It might be kind of thinking of different categories for things. So you might kind of think of like a fruit or a vegetable. Then you might want to go through an alphabetical order and kind of name things in an alphabetical order. So an apple, banana, carrot, all of those sorts of things. And again, all you're doing is redirecting that attention onto something else to just clear your mind and just kind of help you gain some focus. Using these different activities, like I say, removes your mind from uncomfortable thoughts. It helps reduce anxiety. You're not kind of dwelling on those uncomfortable feelings that can precede some kind of migraine triggers. And it's something that you can use at any point of the day, at any place in time. And nobody needs to know that you're doing these sorts of things. It's just something that you can do on your own. So it might be that you just have an experiment of things that you want to do. See what works for you, see what kind of feels most comfortable for you, and just start embed these on a daily basis into your normal routine. So we'll just hand back to Steph just to finish off.
But we're not seeing,
Great, thanks. So there are obviously some things that can be done as well for managing depression. And we know that migraine can lead to many challenges, such as missing social events or time with families, for example, and that ability to work, which can often lead to us feeling like low or depressed. And when you are depressed, or if you feel depressed, or the GP's diagnosed you as having depression, you can't just will yourself to snap out of it, so to speak. And these coping strategies can help you deal with depression and hopefully put you onto the road to recovery. And depression, it drains your energy, your hope, your motivation, and taking small steps can start to help you feel a bit better. And sometimes that is just thinking about the things that you should do to feel better, like exercising or spending time with friends. That can seem exhausting or impossible to put into action. So frequent and regular migraine can also make being motivated harder when worrying about it and if when the next attack will occur. And some people, for example, if they get a particularly bad aura, don't want to leave the house because they don't know when that next aura or migraine is going to come. Are they going to be able to get home? Are you going to be safe? These are the sort of things that can impact and make us feel in those low moods. So it can be a bit of a catch-22 situation, and often the things that help the most are the things that are the most difficult to do. And there is a big difference between what's difficult and something that's impossible. So while recovering from low mood and depression isn't quick or easy, you do have more control than you realize. Even if your depression is severe and persistent, the key is to start off small, the really small steps, and build from there. So part of that might be firstly just reaching out for support and connecting with others, that you might be able to talk to one person about your feelings. You might be able to go out and have lunch with a friend or ask someone that you know quite well to check in with you on a regular basis. It could be just going for a walk with someone or any other small activity that is comfortable for you to do and isn't going to be too draining or overwhelming. And it can also be good to do things that you enjoy or particularly used to enjoy, because sometimes with depression, things that we used to enjoy no longer are things that we want to do. So adding those back in can be helpful. Um, and it doesn't need to be that you spend a long time on it. It could be that you start small, just a few minutes, and that can make all the difference. But we also know that stress does not help depression. So managing stress is important. It can be useful to use the grounding techniques that we've just been mentioned, and reviewing also what is causing you stress and what sort of steps you can take to minimize that. And although exercise can be a trigger for migraine for some people, some level of exercise can often be done, but just be mindful of overexerting yourself. So doing low key exercises for things like trying yoga, for example, or Pilates, or you might enjoy swimming or other gentle exercises, that can really help because it boosts the mood, and it might just help with some of the depression and low mood that you are feeling. And exercise can also actually help with migraine as well. some people that do regular exercise feel that it actually helps to reduce some of their migraine symptoms and migraine attacks. So it's worth trying. And as we know, it's often said for many different mental health conditions or lifestyle is that a good diet and sleep routine can also be helpful for migraine and depression. So eating a balanced diet while avoiding any known food triggers can be helpful. Also eating little and often when needed. So sleep is really, really important. And that's also a migraine trigger. So if you have broken sleep or you're not getting enough sleep, for example, that can trigger migraine. And when we're depressed, we can often sleep too much or not enough. And having a good sleep routine is important. And that can make all the difference to some people for managing things like depression and also migraine as well. So we're coming towards the end, but just to let you know that there is further support out there. So, migraine is a difficult condition to live with, and it's important to remember that you are not alone. So, as you know, the Migraine Trust, we do have a helpline that's open from Monday to Friday, 10 till 4 p.m. You can also email us, you can talk to us on live chat as well, and you can contact us by telephone. Mind is always available as well. So they have information and support for those that may be feeling depressed, and it can be useful to reach out to them if you need someone to talk to. There's also Samaritans and Shout, and they're both open 24/7, and they offer support for those in crisis. So if you feel things have got a bit too tough, or you're really not managing with it and you need that extra support, then it's worth reaching out to both of those as well. And it was mentioned earlier that you can actually self-refer for counselling and talking therapies through the NHS. If you go onto the NHS website and you search for self-refer for counselling, it normally brings up the link to be able to do that. And it can be really helpful just to talk to someone just about what you're feeling so they can help you with some coping strategies and ways to manage that. But I guess the most important thing really is just to remember who you are and you are not alone. Although having migraine can be a really isolating condition, there are organisations and people that you can speak to for support. So do reach out to someone if you need to. And that brings us really to the end. So I hope you found it useful, and just a bit of a snapshot there just of the impact of migraine on mental health and well-being. There's some simple ways in which you can manage that as well, but it brings us over to the Q&A now. So I'll just hand back over to Oscar and we'll see if there are any questions or discussion.
Thank you so much, Steph and Debbie. That was such a great presentation, and I hope everybody has taken away as much as I have from that. So I'll hand over to Oscar. I think there's some questions come through into the chat. There is quite a few, so apologies that we have only got 15 minutes left. If we don't get through them all, Steph has just run through all of the ways that you can get in touch with us. Please do reach out to us and we will try and take those questions offline, but we will try and get through as many as we can now. So I'll hand over to you, Oscar.
Thank you. And yeah, really wonderful presentation, both of you. Yeah, loads and loads of chats, as Deb's just said, and also particularly lots came in and lots of people sharing their stories when you shared yours, Steph. So I think that really resonated with people. So thank you for sharing. So there's been quite a few questions. I'm just going to pick a few of them. So someone said that they've developed depression and dark thoughts due to 2 years of daily migraines with no successful treatments. And they're asking if their depression could be making their migraine worse. So if it's directional and would antidepressants help? And I think that plays into another question of whether sort of medication for mental health, whether that interacts and is safe to take with migraine medication as well.
Yeah, sure, absolutely. So, I mean, depression can have an impact on migraine, particularly if there's anxiety that comes along with that depression as well. And it might be useful, as I said, that particularly with the last slide, is to start putting some very small steps in place to help work through that depression. But we know that depression can be something that can contribute to migraine, but we also know that migraine can also contribute and cause depression as well. So it's a bit of a difficult cycle for that. With the antidepressant question, I think that's more of a question for the GP, but some people do find that if they are in a very low state of depression that is very severe and difficult, that often that can be helpful. but the GP really would need to have a chat, and it could be more beneficial to self-refer for counselling or the talking therapies, CBT, for example, to help with that. But some people may need a combination as well. So there really would be a question for the GP. But ironically, some antidepressants are actually preventive medications for migraine as well. So there could be a factor there that medication used, if they did go on for something for depression, might actually also help with the migraine if the GP uses one that is a known preventive for migraines. So it's certainly an area to consider and chat with the GP about, because it could be useful in some ways.
Yeah, very good point on the crossover. Thank you. Someone's asked how burnout can affect migraine. So another aspect of sort of stress in mental health, how can burnout specifically affect migraine?
Do you want to take that one, Debbie, or?
Yeah, can do. So burnout is when we kind of reach our kind of pivotal point and we're unable to take any more. So what we would probably advise is a degree of self-care. Now, I know Steph had spoke about that earlier in the presentation. So a degree of self-care can help manage your burnout, which can have a direct impact on the amount of migraines. As we spoke about before, the more stressed and more anxious that you become, the more kind of overwhelmed that you feel, you know, you're reaching that point of burnout, you're becoming completely overwhelmed, you're not able to take any more, which can have a direct effect on the amount of migraines that you get. So you would definitely look at things like any sort of self-care, so taking time out, whether or not that would be kind of exercise, whether or not it would be a chat with a friend, whether or not it will be anything that you kind of enjoy that kind of takes your mind off it and kind of lets you recharge your own batteries, as it were. The saying goes, you can't, you know, give from an empty cup, you know, so you want to kind of recharge and refill your own kind of things first. The other thing is, sometimes it's not just as simple as self-care. So sometimes, again, looking at kind of counselling support, you know, if you found that the burnout became too much, where do you talk? Where do you get your help and support from? Is that, you know, chatting to a friend, you know, opening up about how you feel, being quite honest with yourself about how you feel as well, not kind of putting it under and just pretending that these things aren't happening. You know, so start off with some self-care, then move on to, okay, I'm trying this, but it needs to be a little bit more. Then maybe look at some kind of counselling support or extra support, depending on what that is. And hopefully in turn, that should help the impact on your migraines. I hope that's helpful.
Yes, very. Thank you. Thanks both. Okay, so we've had quite a lot of people feeding back just how useful this chat has been and linking up with people with shared experiences, and that it can be very misunderstood. Sometimes people's GPs don't understand, family, friends, people around them. There's been quite a few calls for sort of more support groups, which I think we'd all agree with, something we talk about a lot.
Yeah.
But any suggestions on any online peer support groups or any support groups or places people can access out there at the moment?
Yeah, that's a difficult one, really, because as we know, a lot of like face-to-face groups all shut down during COVID and they haven't set back up again. But what we normally suggest is to speak with your GP surgery and also where your local neurologist or headache clinic is as well, because they might have one that they hold for local people. And I know that one's just been set up at the John Pageant in Norfolk. So they've now got a patient support group for those with migraine. So hopefully we'll see more set up in the future. But a lot of it is really online. And I know we don't at the Migraine Trust do support groups at the moment. And it's something that's on our radar. It's just resources and the ability to do them. But we do signpost to Health Unlocked, which is an online forum that has some really good migraine forums on there where you can connect with other people, where you can talk to them about migraine or just the impact of migraine in general. And Facebook actually does have some good migraine support groups as well. But the only thing we advise, obviously, with Facebook is just be wary of some of the comments that you might get with, you know, holistic and magical cures or treatments. Just be aware of those. But it is a good place to talk to other people in general, just about how migraine is getting you down. If you want someone that, you know, is non-judgmental, understands the condition, so they can be helpful. The Brain Charity have a befriending service as well, so you could contact them. They might be able to put you in touch for a weekly call with someone else that has a migraine or neurological condition. And you know, as I said, the Migraine Trust are always here as well, and that's not just if you've got questions, that is if you just need the support and someone to talk to.
Thank you. Yeah, that's great. So we know there's quite a lot of stigma, and people feel embarrassed or like they can't talk about their mental health because of misunderstanding or things. How would you recommend starting a conversation with your GP about your mental health and getting support for it?
I think it's really important to be honest and open. You know, I think when you suffer from migraines, and it's something that we have, myself and my children, it's about being really open about how you feel. And going to see your GP, I understand that in certain cases, people don't feel as though that they're listened to and that their symptoms are kind of dismissed, you know, but I think reaching out to them and, you know, being totally honest about the impact that this has on your mental health on a day-to-day basis, the quality of your life, and actually really highlighting, you know, how much it does affect you, and the wider impact as well. It's not just on yourself, but it's about your family, what you do, what you can accommodate, your work, everything. Initially, what I would probably say is just you can self-refer for counselling and counselling support, and you could do that as an option if you don't feel comfortable having a conversation with your GP. But if you are willing to go to your GP and ask for some help and support, they can also make a referral for counselling and talking therapies. And what I would say is counselling is really beneficial when you are feeling so low and it's having kind of a negative effect on your mental health, and it's finding the right type of counselling. So we talk about counselling as like one big umbrella, but it does kind of come down to different modalities of counselling. So even though somebody will say, oh, I've tried this before and it didn't work, please persevere, because there are different modalities. And not only that, it's having a good connection with your counsellor. So if you feel as though that you're able to relate to someone and that you're able to offload, you'll feel much more open to kind of sharing how you truly feel. And in essence, that's what's going to make you feel better, and that's what's going to have the bigger impact for you. So I would say two options: self-referral to some of the free counselling services, or if you're feeling brave enough to go to your GP, take it with a pinch of salt that sometimes they can be quite dismissive, but just persevere that this is a referral that you want, and then being quite open about the type of counselling that they refer you to, the different modalities that are available. And again, don't be afraid to say that you want to try somebody else if you don't feel as though that you're gelling with someone, because actually it might just be that the person who you have isn't sympathetic to your needs, and it just might be that you don't connect with that person. So there's a few starting points that you can kind of start at, and come back to us if you need to.
Yeah, I think that's a really good point. Someone commented in the chat they hadn't found CBT helpful for them, and that's it is such an individualized thing, isn't it? And for some people, counselling isn't for them. For others, it is, but also it is about the type of counselling, the type of counsellor, all sorts. So yeah, really important. We may only have time for one more, and I'm sorry, I know there's loads and loads of questions. I've just been specifically picking out ones that are to do with this chat, but everything, I've read everything you've written, all your stories, and it's really powerful. And all the questions you've asked, we can answer, so do get them into us afterwards if you'd like them answered.
Email them over. I'm more than happy to answer them. There's no problem at all.
So yeah, last question then. So you talked a lot about the sort of impact of menopause and hormones on sort of mental health and things. And someone said that they're postmenopausal and struggling with sort of menopausal symptoms and including anxiety and things. And they're just considering HRT and sort of worried about the safety of it and asking around kind of, can it help migraine? Is it something that they can consider? Where to sort of go to talk about that and things like that?
Yeah, absolutely. Do you want this one, Debs, as your women's health, or
so HRT is completely safe to take with migraine medication, absolutely fine. What you might find is depending on your symptoms, so for instance, if you've got menopausal symptoms, so a degree of anxiety, low mood, low self-esteem, you know, as a result of menopause, the HRT can help with some of those, which may have a direct impact on how you feel in relation to your migraine, but it won't directly improve your migraines and how often that you get them. So HRT is not a treatment for migraines, but it is a treatment for the menopausal symptoms, which can impact the migraines. I hope that makes sense. And again, it's looking at how we manage those, looking at your menopausal symptoms. Things like auricular acupuncture can be really good. So if it's not kind of HRT that you wanted, accessing acupuncture can be really beneficial. It doesn't impact on anything. It's not going to impact on any of your other medications. So I think just being clear, you can take HRT alongside migraine medications, but the HRT will affect your menopausal symptoms, not the migraine itself. But what you can find is some of the effects of the menopause can impact your migraines. Bit confusing, but hopefully I've said that in a clear way.
Some people find as well with HRT that it can make their migraine worse. And it can take a good 3 months or so on HRT for everything to settle down. So you do kind of have to persevere with it. But if you find that the migraines worsened and that you can manage the menopausal symptoms without the HRT, then often many people will stop it. But the general advice, and there's a really good fact sheet actually by the Women's Health Concern on migraine and HRT that's worth having a look at.
Yeah.
And the general advice is that for HRT, it's just the lowest dose of HRT that you need to manage the menopause symptoms. Don't keep increasing the dosage to manage the migraine, because that's not going to help.
Yeah. And again, it's just being aware that when we talk about HRT, again, we talk about that quite widely. Again, like anything, there are different forms of HRT preparations that you can have, all used for different things. So when we're talking about it, I'm not talking about one necessarily specifically. So again, it's having a good conversation with a GP or an expert menopause clinic, and they will look at your symptoms directly and pick the right HRT that will help your symptoms.
Thank you so much. That brings us nicely, very closely to 1 o'clock. So thank you both so much. Apologies again that we haven't got through all of the questions, but please do reach out to any of our support services. I know there has been lots of chat about different support that people are looking for, and it is something as an organisation that we're aware of that people need. Towards the end of June, keep an eye out on our socials and our website, because we will be putting out a survey to look at the future of our support services. So any feedback from that would be really great. We are a really tiny organisation. There's only 12 of us. People are always amazed when I tell them there's only 12 of us, but there are. And so resources and funding is limited, but we are really committed to offering the best support that we can. So as I say, look out for that survey and please fill it in. There's also the mental health survey, and there is the evaluation form that will be hitting your inbox any minute. So lots to engage with us. So I will end that there. Say thank you to Debbie and Steph, and thank you all for joining, and we hopefully see you soon. Bye.